So till now, we discuss about the effect of different hormones, right, on the body, female body. Then we discuss the conflicts, right? Two conflict: nest worry conflict and separation conflict. And then we discuss the uh, basically sides of the breast, right? That right side of the breast is for the partner, and or any other person who is not connected to the any other person who is not connected or a past part of a nest, right? But that person is related in her life, then the right person is involved. And if there is issue with the child or if issue with the pet, right, which is past part of the nest, then the left breast is involved. So this is how the side affinity works in this case. You can, so these are basically these are hints, and they are not the ultimate truth, and they are hint, and you can use it in the prescription. Then another question is how to resolve it, how to resolve the conflict. This is very important. So what to do in this cases to resolve this conflict? First is to identify the conflict, right? So what we do, we take it case taking in detail, what is affecting the patient, how it is disturbing him. Then we address that basically, right? We try to rebuild the connect. We can rebuild the connect by communication, right? Communication with the patient, or communication between the person if there is the issue of separation with the husband, right, or somebody else which is disturbing him or her. Then we establish that communication so that the flow of emotions which is stuck or stopped, that's start moving in that condition. The condition patient will feel better in overall condition, overall state. Second is, if for example there is no option for the communication, right? Patient don't want to communicate or don't want to overcome that by communicating. Then to accept it in the life. Yes, this is the issue and this will remain for me forever. So patient has to address that, right? To give the emotional closure. So this is very important, right? How to give the emotional closure to that patient or that issue particularly which is disturbing the patient. And then after that, the most important part is reassurance yourself basically. That is consciously affirming, give affirmations that everything is all right, everything is well, I am getting better, things are getting better, everything will be recovered very soon. So these things are very important in this condition. And then the medicine, role of medicine. So only medicine will not work basically. If issue is this, issue is a conflict deep within the patient, then medicine will not work, right? Suppose I give you an example. There is a 3 days back I have one case. The issue is that that patient is having issue with her with his wife, that he was annoyed with him, right? Due to him there is a disturbance in the environment at the home, and due to which his brother get divorced, right? Now there is no going back. Now there is no option that he can unwind or undo all conditions. This is not possible. So the patient is thinking that I am having a feeling of guilt which is irreparable. I can't unwind, and I cannot undo this. So this is the conflict basically is going through, and it is very important to give the emotional closure. So we can motivate the patient to talk with her wife or a brother to tell his side of the story so that things get better in that condition. And if this is not possible, right, then to create an acceptance for emotional closure and give medicine for that. Right? We take rubric for this condition, so which will help that patient in this regard. So this is very important key how we resolve this. Right? Other thing, I can give you some example of the cases later on. In the end, I will give you some example. And other thing which is very important is in this condition is diet. right? As we discussed, diet in the role of diet in diabetes. In this also, just like in diabetes, in this condition also, we have to give patient, we have to recommend the diet which is of low glycemic index, right? But now in this condition, the real problem is the estrogen predominance, right? Now, due to this, we have to suggest our patient a diet which control the estrogen predominance, or which help the body to eliminate estrogen from the body. So these two things are very important. So for this, first we must know which are the food which are aggravating the insulin predominance, and which are the food which are helping to reduce the estrogen from the body. So red meat, right, or full fat dairy, red meat, animal products, high fat animal products, all these things are basically, it stimulate the estrogen level in the body. So patient should be patient should stop eating all these things strictly, right? There is no option. So no red meat, no full dairy products in this in condition when patient is suffering from fibroadenoma or fibrocystic adenoma, or due to any other conditions where estrogen predominance is the cause. Another important thing which is very important, that how estrogen is metabolized in the body. So estrogen is metabolized by the liver, right? And then it was sent into the intestine through the bile, where now whenever estrogen after metabolization goes into the bile and then to the intestine, there is a chances for reabsorption, right? So we have to stop this. So this phenomenon is called enterohepatic circulation. That again, that enterohepatic circulation will absorb the estrogen which is metabolized by the liver. So for that condition, you should advise your patient to take high fiber diet, because fiber attached to the estrogen which are metabolized in the intestine, that they get attached to them and help to expel them from the body, right? With and prevent to reabsorb by the intestine. So this is very important, right? So when you add the fiber diet, it has two roles. First, it will attach to the estrogen. Second, high fiber diet, it reduces the blood sugar level, right? So in that condition, whenever blood sugar level is more, we need more insulin. Whenever more body is having a more insulin, then it prevents the ovulation. It delays the ovulation, due to which there is a more production of the estrogen. As in that condition, the patient is not able to produce progesterone, which is the counterbalance for the estrogen. So first, avoid the red meat and full dairy. Second, increase the fiber, right? And next very important thing is phytoestrogen. Now what are the phytoestrogen? Phyto means plant, estrogen means estrogen. So they are the plants which are very similar to the estrogen, right? Their chemical formula and shape is very close to the estrogen. And as we know, in the body, the hormones work, how they work? They work as a lock and key, like a lock and key, right? That, for example, the hormone came and there is one receptor for that hormone. When hormone attached to, firmly with that receptor, then it get activated and its effects start getting into the body. But now, because the phytoestrogen are just like estrogen, suppose so you can say this is the shape of the estrogen. They are just like estrogen, but of slightly different shape, slightly variation in that. But due to this slight variation, right, what happened when they get into that receptor, they attach to that receptor loosely, not exactly fitting into that receptor, that attach little bit loosely. So now, due to this loosely attachment of the phytoestrogen into the receptor of the estrogen, where estrogen get attached, and receptors are mainly in the breast, uterus, bones, and brains, right? Brain area, one per receptors, and there are more receptors in that area. Now, due to that loose attachment, two things happen in this condition. First, they compete the real estrogen, right? Because they block the receptor. So, in this condition, the effect of the estrogen became less on the body. In spite of having the more estrogen in the body, the effect of estrogen, for which it needs reactivation of that receptors. So they compete with the original estrogen. So in this way, it helps the body. So in case of high estrogen level, the presence of this phytoestrogen, they compete with the real estrogen. In this way, it helps that patient. And second is due to the loose attachment. Due to the loose attachment, they are not able to stimulate that receptor potentially, like potently. For example, if estrogen get attached, it is a strong bond, that receptor will activate it 100%. But now this is a loose bonding. This is a loose bonding. So you can say that now this receptor work for 60 to 65% only. So one, they compete with the estrogen. This is how they are helping in this condition. Second, the effect which they are creating is less in intensity and quantity. So in both condition, patient will help. We can help this patient. So these phytoestrogens are very important, and we should tell the patient to have more of this phytoestrogen. So in this condition, it affects the it block that, right? And think of a condition when there is a menopause. In menopause, the patient is already having the less estrogen and less progesterone. Now, in that condition, what happens? In that condition, when the estrogen is less, right, and receptors are many, then they act as they create a criteria where they produce estrogen basically, right? In the absence of estrogen, they will help the receptor to produce some amount of estrogen, not that much potently, but some amount of estrogen, which will help the patient in a menopausal age to improve their bone density, to for example, and decrease the hot flushes, right? So in this way, it helps curatively in that condition. So when estrogen is more, it acts as a blocker. When estrogen is less, right, then it acts as a stimulator. So in this way, it is very, very helpful. And that is phytoestrogen. Now, what are the diet? What are in which we have more phytoestrogen, right? Very commonly tofu, right? Tofu, soy milk, right? Then flax seeds, then legumes, chickpeas, whole grain, right? Then fruits like berries, strawberry, blueberry, apple, pomegranate. Then vegetables like broccoli, spinach, carrot. All these things contain a lot of phytoestrogen. So you should recommend your patient to have these things more, right? Phytoestrogen. Other thing, the low GI diet, glycemic index diet is very important. So whenever you are having this patient, you must tell him to take diet accordingly. So specifically in the fibroadenoma patient, you will tell your patient to decrease the red meat and full dairy, increased fiber intake, eat phytoestrogen food, and you should give the medicine or thing which should support the liver, right? To make liver stronger so that it will act in a good way to metabolize the excess estrogen. And because in any liver disease, this will go down. So this will affect indirectly to the patient. So we should also give the antioxidant like turmeric, garlic, and in anti-inflammatory diet. This is very important, like low on caffeine, chocolate, tea, alcohol. Right? This should be low, and low GI diet. This is very important. And in fibrocystic adenoma, condition of fibrocystic adenoma, because in this condition there is a collection of the fluid and the whole breast is involved. In this, it is very important to guide your patient to reduce caffeine. Caffeine is very important, right? And food, and you will tell the patient to take food rich in iodine in that condition, like iodized salt, eggs, seafood. And you should advise the patient to take more vitamin E and magnesium. Like you can advise your patient to take to have almond, banana, or pumpkin, leafy vegetables, and this will help to reduce the breast tenderness. This is very important. And then other things which are important in fibrocystic adenoma are cruciferous vegetables, right? Like broccoli, cauliflower. This is very important. They are also a low glycemic index diet that is important in both the condition and hydration. So in this condition, you can advise your patient to take diet according to the complications, right? And other things. And second aspect, now this is the diet which affects the estrogen part. Now diet which is affecting the progesterone part. So we have to give the diet which lower the estrogen, and then we have to recommend the diet which increase the progesterone, right? So what are the pro-progesterone diets? So because when we increase the progesterone level, it will decrease the breast tenderness, it will decrease the swelling, it will decrease the cyst formation. So in this diet, and as we know, the progesterone is made from the cholesterol, right? So cholesterol se banta hai. So we should give the good cholesterol to the patient, right? So healthy cholesterol देंगे हम patient को. So for that, nuts is very important. Seeds are very important, right? Olive oil and fish oil. These are very important in this condition. Then vitamin B6, right? B6 affect the luteal phase of the menses. So B6 is very important in this condition. It will push the progesterone levels and other things. And what are the various things like B6, banana, chickpeas, sunflower seeds, tuna fish, potatoes, spinach. These are the things you can use in this condition. Another thing which is very important is magnesium. Magnesium is having the very important role basically also for the sleep cycle, right? So basically magnesium support the adrenal gland and hence it increase the progesterone production. So dark leafy vegetables, almonds, cashew, dark chocolate is very, very important, right? One bite of a dark chocolate, minimum 90%, it is very bitter, but it is very good in this condition. Dark chocolate, pumpkin seeds, right? Then vitamin C. For that, orange, strawberry can be used, right? Broccoli can be used. Then zinc is very important, right? Because zinc stimulates the pituitary gland. So zinc can be in the oyster, eggs, chickpeas. And in this condition, like we talk about the seeds. So in these seeds, there is one system, it's known as the seed cycling. As I told you that sunflower seeds affect the luteal phase. So basically different seeds affect the different phases of the menstrual cycle. So flax seeds and pumpkin seeds, जो कद्दू से होता है, pumpkin seeds and flax seeds, they affect the follicular phase of the menstrual cycle, and sunflower and sesame seeds, til, they affect the luteal phase, right? So you can give these two, for example, flax and pumpkin for the first 14 days and sunflower and sesame for the last 14 days. So this is known as seed cycling. So you can use this condition for the benefit of the patient. Other thing, which food which we should avoid, right? First, which is very important, is refined carbs, right? We discussed in hell of a detail in this when we discussed in diabetes, that is processed carb. They are very important. Processed food, we should not take them. With that, trans fats and alcohol. Alcohol, the reason is only that because if we patient take alcohol, then body, the liver take alcohol as a priority and stop all other functioning. In that condition, there is a chronic damage to the liver which indirectly affect the estrogen metabolism, which is very important for the expulsion of the estrogen from the body. So in this way, they affect the overall this condition. So these are the things which affect. So these are the factor in the diet which is very important, and this is enough for the diet.